As a neurologist, the silent stroke. Symptom: 80% of people over 50 ignore until it's too late. In my 28 years as a neurologist at Cleveland Clinic's Cerebrovascular Center, I've witnessed a heartbreaking pattern that repeats itself with such devastating regularity that I can no longer remain silent about the warning sign that could save your life. Yet 8 out of 10 Americans over 50 dismiss it as a normal part of aging until a catastrophic stroke leaves them permanently disabled or dead. My name is Dr. James Thompson, and what I'm about to share isn't just another medical warning. It's an urgent plea based on thousands of stroke cases where patients and their families all said the same haunting words. If only we had known that symptom meant a stroke was coming, we could have prevented this nightmare. The silent symptom I'm referring to has been staring us in the face for decades, documented in medical literature, observed in countless patients, yet somehow remains dangerously unknown to the general public who continue to ignore this critical warning sign while their brain tissue slowly dies, setting the stage for a massive stroke that will destroy everything they hold dear. Last week I stood beside the bed of Margaret Wilson, a 58-year-old grandmother who had been planning her retirement, dreaming of traveling with her husband and looking forward to watching her grandchildren grow up. But now she lay motionless, unable to speak, move or even swallow on her own because she ignored the silent symptom that had been warning her for months. Her daughter Jennifer held her mother's limp hand, tears streaming down her face, as she told me. "She mentioned it a few times, doctor, but we all thought it was just stress, just getting older, just something that would go away on its own." How were we supposed to know it meant her brain was dying? The answer breaks my heart every time, because this silent symptom is so clear, so predictable, so treatable when caught early. Yet our medical system has failed to educate the public about this crucial warning sign that appears in over 80% of people before a major stroke strikes. The symptom, Margaret and millions of others ignore, is sudden unexplained episodes of profound fatigue that feel different from normal tiredness. A bone-deep exhaustion that comes out of nowhere, lasts for hours or days, then mysteriously disappears, only to return with increasing frequency and intensity. This isn't the fatigue you feel after a poor night's sleep or a long day at work. This is a crushing exhaustion that feels like your brain has suddenly run out of fuel, like someone has pulled the plug on your entire nervous system, leaving you unable to think clearly, concentrate, or perform even simple tasks. Patients describe it as feeling like their head is filled with cotton, like they're moving through thick molasses, like their thoughts are traveling through fog. And most dangerously, they almost universally dismiss it as stress aging or needing more sleep, never realizing their brain is literally suffocating. What's actually happening during these episodes of profound fatigue is that small areas of your brain are experiencing mini-strokes, also called transient ischemic attacks or silent strokes, where blood flow is temporarily reduced or blocked, depriving brain cells of oxygen and causing them to malfunction or die. These silent strokes often affect areas of the brain that don't control obvious functions like movement or speech, so instead of dramatic symptoms like paralysis or slurred words, you experience this crushing fatigue as your brain struggles to compensate for the damaged areas. Research from the National Institute of Neurological Disorders shows that people who experience these episodes of unexplained profound fatigue are 23 times more likely to suffer a major stroke within the next year, yet most never mention it to their doctors or seek treatment until it's too late. The tragedy is that when caught early, we have incredibly effective treatments that can prevent that major stroke from ever happening, from blood thinners to surgical interventions that can clear blocked arteries. But we can only help if patients recognize the warning and seek treatment. Margaret had been experiencing these episodes for 6 months before her stroke, sometimes unable to get out of bed for entire days, telling her family she just needed rest, never realizing that each episode was another small stroke destroying irreplaceable brain tissue. Her husband Robert sat in my office, shoulders shaking with sobs, as he said she was so tired all the time, doctor, but she kept saying it was just her job, just menopause, just part of getting older. I should have insisted she see someone. I should have known. Something was terribly wrong. But how could Robert have known when even many healthcare providers miss this crucial symptom when medical schools barely mention it, when public health campaigns focus on dramatic stroke symptoms while ignoring this silent killer that provides months of warning before the catastrophe strikes. The medical term for this symptom is cerebral hypoperfusion fatigue, and it occurs when your brain isn't getting enough blood flow to function properly, usually due to narrowing arteries, small clots, or other vascular problems that restrict oxygen delivery to brain tissue. Your brain uses 20% of your body's oxygen supply, despite being only 2% of your body weight, making it exquisitely sensitive to even small reductions in blood flow that might not affect other organs, but devastate your cognitive function and energy levels. During these episodes of profound fatigue, specialized brain scans would show areas of reduced blood flow, tiny infarcts where brain cells have died, and changes in brain metabolism that explain why patients feel so utterly exhausted. But these tests are rarely ordered because patients don't report the symptom. The pattern is almost always the same, starting with occasional episodes lasting a few hours, dismissed as bad days, then progressing to more frequent attacks lasting entire days, then multiple days in a row. Each episode representing more brain damage, more warning that a major stroke is imminent. What makes this symptom particularly dangerous is that it often improves temporarily, giving patients false reassurance that whatever was wrong has resolved itself, when in reality their brain has simply recruited other areas to compensate for the damage, a temporary fix that will inevitably fail. I've reviewed thousands of cases where patients experienced months or even years of these warning episodes before their major stroke, and in virtually every case they never told their doctor, never sought help, never realized they were experiencing the most important warning sign their brain could give them. The reasons people ignore this symptom are complex but predictable, including the normalization of fatigue in our overworked society, the attribution of tiredness to aging, the fear of being seen as complaining about vague symptoms, and the lack of public awareness about this critical warning sign. Women are particularly likely to dismiss this symptom, attributing profound fatigue to hormonal changes, family responsibilities, or emotional stress, while their brains slowly lose function due to inadequate blood flow that could be easily treated if identified. Men often ignore the symptom due to cultural conditioning that equates fatigue with weakness, pushing through the exhaustion with caffeine and willpower, while their cerebral arteries narrow and clots form, setting up the perfect conditions for a devastating stroke. The age group most at risk, those over 50, are also most likely to dismiss the symptom as normal aging, accepting profound fatigue as an inevitable part of getting older rather than recognizing it as a medical emergency requiring immediate attention. Healthcare providers often miss this symptom too, focusing on more dramatic presentations while overlooking patients who complain of fatigue, ordering basic blood work that comes back normal while failing to investigate the vascular causes that don't show up on routine tests. The consequences of missing this warning sign are catastrophic, with major strokes leaving patients unable to walk, speak, care for themselves, or recognize loved ones, transforming independent adults into completely dependent individuals requiring round-the-clock care. Margaret's stroke left her with what we call locked-in syndrome, where she's fully conscious and aware but unable to move or communicate except through blinking, trapped in a body that no longer responds to her commands, a prisoner in her own flesh. The financial devastation is equally severe, with acute stroke care costing an average of $150,000 in the first 3 months, followed by years of rehabilitation, home modifications, and caregiving expenses that bankrupt families and destroy retirement savings built over lifetimes. But here's what makes me angry enough to write this urgent warning. Every one of these tragedies is preventable if we simply educate people about this silent symptom and encourage them to seek help when their brain sends this desperate signal for assistance. When patients come to me reporting episodes of profound unexplained fatigue, I immediately order specialized tests, including carotid ultrasounds, to check for arterial blockages, transcranial Doppler studies to assess blood flow to the brain, and MRI scans that can detect tiny strokes invisible on CT scans. In over 70% of cases, we find treatable problems like carotid artery stenosis, where plaque has narrowed the main arteries feeding the brain atrial fibrillation, causing small clots or other vascular issues that can be addressed before they cause a major stroke. The treatments are often simple and highly effective, ranging from daily aspirin to prevent clots, statins, to stabilize plaque blood pressure medications, to reduce stress on vessels, or in more severe cases, procedures to open blocked arteries or remove dangerous plaque. One of my patients, Thomas Anderson, came to me after his wife insisted he get checked for exhaustion episodes that were affecting his work as an architect, and we discovered 90% blockage in his left carotid artery, a stroke waiting to happen. After a relatively simple procedure to clear the blockage, Thomas's fatigue completely resolved, his cognitive function improved dramatically, and he avoided the major stroke that would have likely killed him within months based on the severity of his arterial disease. He now tells everyone he meets about the importance of not ignoring profound fatigue, becoming an advocate for stroke prevention after realizing how close he came to catastrophe simply because he almost dismissed his symptoms as work stress. The key to recognizing this dangerous fatigue is understanding how it differs from normal tiredness with specific characteristics that should trigger immediate medical attention rather than rest or lifestyle changes that won't address the underlying vascular problem. First, this fatigue comes on suddenly without obvious cause. Unlike normal tiredness that builds gradually after exertion or sleep deprivation, this exhaustion hits like a wall, often in the middle of activities you normally handle easily. Second, it's disproportionate to your activity level. Feeling utterly exhausted after minimal physical or mental effort, needing to rest after simple tasks like getting dressed or having a conversation, a dramatic change from your normal energy patterns. Third, sleep doesn't help. Even after a full night's rest or daytime naps, the exhaustion persists because the problem isn't lack of sleep, but lack of oxygen to brain tissue that's slowly dying from inadequate blood flow. Fourth, it's accompanied by cognitive changes, difficulty concentrating, memory problems, feeling mentally foggy or confused, words coming slowly or getting lost mid-sentence, all signs that your brain isn't getting enough oxygen to function properly. Fifth, it occurs in episodes rather than being constant periods of profound fatigue, alternating with times of normal energy, a pattern that reflects the intermittent nature of small strokes or temporary arterial blockages that characterize pre-stroke syndrome. If you experience even one episode of this type of fatigue, especially if you're over 50, or have risk factors like high blood pressure, diabetes, smoking history, or family history of stroke, you need immediate medical evaluation, not next month, not when convenient, but now. Tell your doctor specifically that you're experiencing sudden, profound fatigue that feels different from normal tiredness, that you're concerned about stroke risk, and that you want vascular screening to rule out cerebral hyperperfusion or silent strokes. Don't let healthcare providers dismiss your concerns or attribute everything to stress or aging. Insist on proper evaluation, including imaging studies and blood flow assessments, remembering that advocating for your health could literally save your life. The tests needed to evaluate this symptom are non-invasive and widely available, including carotid ultrasound that uses sound waves to visualize arterial blockages, transcranial Doppler that measures blood flow velocity in brain arteries, and MRI that can detect tiny strokes. Blood tests can identify risk factors like elevated inflammatory markers, abnormal clotting factors, or metabolic issues that contribute to stroke risk, providing valuable information for prevention strategies, even if imaging studies are initially normal. Many insurance plans cover these tests when ordered for appropriate symptoms, and even if you have to pay out of pocket, the cost is insignificant compared to the financial and personal devastation of a major stroke that could have been prevented. Beyond testing, there are immediate steps you should take if you're experiencing these fatigue episodes, starting with daily low-dose aspirin, if approved by your doctor, as this simple intervention can reduce stroke risk by up to 30% in appropriate patients. Monitor and control your blood pressure, as hypertension is the leading modifiable risk factor for stroke, with every 10-point reduction in systolic pressure, reducing stroke risk by 25%. Making blood pressure management literally life-saving. If you smoke, stop immediately, as smoking doubles stroke risk, and quitting provides benefits within weeks, with stroke risk returning to near normal within 5 years of cessation, making this one of the most powerful prevention strategies available. Manage diabetes aggressively if present, as elevated blood sugar damages blood vessels and increases clotting risk with good glycemic control, reducing stroke risk by up to 40% in diabetic patients who maintain target glucose levels. Exercise regularly but carefully, starting with gentle activities like walking. If you're experiencing fatigue episodes, as moderate exercise improves cerebral blood flow and vascular health, while excessive exertion during these episodes could be dangerous. Adopt a Mediterranean-style diet rich in vegetables, fruits, whole grains, fish, and olive oil, as this eating pattern has been shown to reduce stroke risk by 35% through multiple mechanisms, including improved vascular function and reduced inflammation. Stay hydrated, as even mild dehydration can reduce blood flow to the brain and exacerbate fatigue symptoms, aiming for at least 64 ounces of water daily unless restricted by your doctor for other medical conditions. Manage stress through evidence-based techniques like meditation, deep breathing, or yoga, as chronic stress contributes to hypertension and vascular dysfunction that increase stroke risk while also masking the warning signs of cerebral hypoperfusion. Get quality sleep addressing issues like sleep apnea that dramatically increase stroke risk while also causing fatigue that might mask the more serious cerebral hypoperfusion fatigue that signals impending stroke. Limit alcohol consumption, as excessive drinking increases stroke risk through multiple mechanisms including hypertension, atrial fibrillation, and direct toxic effects on blood vessels, with moderation, meaning no more than 1 drink daily for women, 2 for men. Take prescribed medications consistently, as many patients stop taking blood pressure or cholesterol medications due to side effects or feeling better, not realizing these drugs are preventing the stroke that their fatigue episodes are warning about. Create a symptom diary documenting when fatigue episodes occur, their duration-associated symptoms and potential triggers, providing valuable information for your healthcare provider to determine the pattern and severity of your cerebral hypoperfusion. Involve family members in recognizing symptoms, as cognitive changes during fatigue episodes might prevent you from fully appreciating their severity, with loved ones often noticing changes in speech behavior or function that you might miss. Don't wait for multiple episodes before seeking help, as each episode of profound fatigue could represent additional brain damage, with early intervention after the first episode providing the best opportunity to prevent permanent disability. Consider getting a second opinion if your concerns are dismissed, as many healthcare providers still don't recognize cerebral hypoperfusion fatigue as the critical warning sign. It is making persistence in finding answers potentially life-saving. The technology now exists to prevent most strokes if we catch them in the warning phase, with advanced imaging showing us exactly where arteries are narrowing, where plaque is unstable, and where intervention can restore healthy blood flow to the brain. Artificial intelligence is beginning to help us predict stroke risk with remarkable accuracy, analyzing patterns in symptoms, imaging, and biomarkers to identify patients at highest risk who need immediate intervention to prevent catastrophe. Telemedicine makes expert stroke prevention consultation available even in rural areas, allowing patients experiencing warning symptoms to access specialized care that could save their lives without traveling to major medical centers. New medications and procedures continue to expand our ability to prevent strokes, from novel anticoagulants with fewer side effects to minimally invasive procedures that can clear blocked arteries with minimal risk and rapid recovery. Yet all these advances mean nothing if patients don't recognize and report the warning symptom of profound fatigue, if they continue to dismiss their brain's desperate plea for help as just another sign of aging or stress. Public health campaigns spend millions educating about dramatic stroke symptoms like facial drooping and arm weakness, crucial information, but arriving too late for prevention while virtually ignoring the silent symptom that provides months of warning. Medical schools devote minimal time to teaching about pre-stroke syndromes and warning signs, producing doctors who might recognize a stroke in progress but miss the opportunity to prevent it when patients report profound fatigue. Insurance companies, despite the enormous cost of stroke treatment, often resist covering preventive screening and intervention penny-wise and pound foolish policies that result in preventable catastrophes costing millions in acute and long-term care. Employers rarely recognize that workers experiencing cerebral hypoperfusion fatigue are at risk for stroke, instead pressuring them to push through exhaustion, inadvertently contributing to the stress and vascular dysfunction that accelerates stroke risk. Families attribute loved ones' fatigue to depression, aging, or personality changes, providing support for the wrong problem, while the real issue, inadequate blood flow to the brain, continues to worsen toward inevitable catastrophe. The solution requires a fundamental shift in how we think about fatigue after 50, recognizing it not as an inevitable part of aging, but as a potential medical emergency requiring the same urgent attention we'd give chest pain or difficulty breathing. Every person over 50 should know that sudden profound fatigue, different from normal tiredness, is a stroke. Warning requiring immediate medical evaluation. Not rest, not vitamins, not lifestyle changes, but proper vascular assessment. Healthcare providers must be educated to take fatigue seriously in older adults, ordering appropriate tests rather than attributing everything to stress or aging. Recognizing that this symptom often represents the only warning before a devastating stroke. Insurance coverage must expand to include preventive stroke screening for high-risk individuals, recognizing that preventing one major stroke saves more money than denying coverage for thousands of screening tests, both financially and in human terms. Workplaces need policies that encourage employees to seek medical attention for concerning symptoms, rather than pushing through creating cultures where health is valued over short-term productivity that becomes meaningless after a stroke. Families must learn to recognize profound fatigue as a medical symptom, requiring attention, supporting loved ones in seeking evaluation, rather than dismissing concerns or attributing everything to normal aging that isn't normal at all. The media has a responsibility to educate about pre-stroke warning signs with the same vigor applied to heart attack symptoms, potentially saving thousands of lives through awareness campaigns about cerebral hyperperfusion fatigue. Medical technology companies should develop home monitoring devices that can detect signs of reduced cerebral blood flow, allowing early identification of at-risk individuals before they experience their first episode of profound fatigue. Pharmaceutical companies researching stroke prevention should prioritize medications that address cerebral hypoperfusion, potentially developing drugs that could be started at the first sign of fatigue to prevent progression to major stroke. Communities should organize stroke prevention education programs focusing on warning signs like fatigue, creating support groups for those experiencing symptoms, and connecting them with appropriate medical resources before it's too late. Schools training healthcare providers must emphasize the importance of pre-stroke syndromes, teaching future doctors and nurses to recognize and respond to warning signs rather than waiting for dramatic symptoms that signal irreversible damage. Research funding should prioritize understanding why some people experience warning fatigue while others have strokes without warning, potentially identifying biomarkers that could guide more personalized prevention strategies. Patient advocacy groups should demand better education about stroke warning signs, pushing for public health campaigns that go beyond fast acronyms to include the subtle symptoms that provide the earliest opportunity for prevention. The technology sector could develop apps that help people track fatigue patterns and alert them when symptoms suggest possible cerebral hypoperfusion, connecting them with healthcare providers specializing in stroke prevention. Insurance companies should incentivize preventive stroke screening through reduced premiums for those who undergo regular vascular assessment, recognizing that prevention is far more cost-effective than treatment and rehabilitation. Employers could offer executive physicals that include comprehensive stroke risk assessment, protecting valuable employees, while demonstrating that worker health is a priority worth investing in for long-term success. As I write this urgent warning, Margaret Wilson remains in our neurological intensive care unit, aware but unable to move or speak. Her daughter maintaining a constant vigil, both of them trapped in a nightmare that began with ignored fatigue. Her case isn't unique or unusual, it's heartbreakingly common, repeated daily in stroke units across America, where families learn too late about the warning sign that could have prevented their tragedy. The stroke that destroyed Margaret's life didn't happen in the moment her brain was deprived of oxygen. It began months earlier with those first episodes of profound fatigue that she dismissed as nothing important. Every patient I've treated for major stroke had warning signs, and in the vast majority of cases, profound fatigue was the first and most persistent symptom, yet almost none sought help specifically for this symptom. The lucky few who do seek help for unexplained fatigue often discover treatable conditions in time to prevent stroke going on, to live full, healthy lives, grateful they listened to their body's warning instead of pushing through. These success stories motivate me to spread this message as widely as possible, knowing that for every person who reads and acts on this information, a potential stroke and all its devastating consequences might be prevented. The science is clear, the warning sign is consistent, the treatments are effective, yet we continue to see preventable strokes because the message hasn't reached those who need it most, the millions experiencing fatigue they attribute to everything except its true cause. If you're over 50 and experiencing sudden profound fatigue that feels different from normal tiredness, please don't become another tragic story of missed opportunity. Seek medical evaluation focused on stroke risk, not general health screening. Tell your doctor you want specific tests to rule out cerebral hypoperfusion and silent strokes, including carotid ultrasound, transcranial Doppler, and brain MRI, insisting on thorough evaluation, even if initial tests seem normal. Don't accept dismissive explanations about stress or aging without proper vascular assessment, remembering that your life and independence depend on identifying and treating the cause of your fatigue before it progresses to stroke. Share this information with everyone you know over 50, especially those who've mentioned feeling unusually tired, as you might save their life by helping them recognize their fatigue as the medical emergency it truly is. Create a family culture where health symptoms are discussed openly and taken seriously, where seeking medical attention for concerning symptoms is encouraged rather than seen as overreacting or wasting resources. The future of stroke prevention lies in recognizing and responding to early warning signs like profound fatigue, transforming our approach from reactive treatment after devastating damage to proactive intervention while prevention is still possible. Imagine a world where stroke units are nearly empty because people recognized warning signs and sought help in time, where families aren't destroyed by preventable catastrophes, where aging doesn't mean accepting inevitable decline. This future is possible, but requires action from everyone reading this message, from individuals experiencing symptoms to healthcare providers, treating patients to policymakers, determining healthcare priorities and funding. The silent symptom of profound fatigue will only remain silent if we continue to ignore it. But by spreading awareness and encouraging action, we can transform this warning sign into a life-saving alarm that prevents countless tragedies. As I complete my rounds tonight checking on stroke patients who might have avoided their fate if they'd known what you now know, I'm both saddened by preventable suffering and hopeful that this message will reach those who need it. Margaret Wilson will never travel with her husband or play with her grandchildren, as she dreamed locked forever in a body that betrayed her because she didn't know that profound fatigue was her brain's cry for help. But you now have knowledge. Margaret didn't understanding that sudden unexplained fatigue after 50 isn't normal aging, but a potential stroke warning, requiring immediate attention and proper medical evaluation. The power to prevent your own stroke story lies in recognizing and acting on this warning sign, seeking help while your brain can still be saved rather than waiting until the damage is irreversible and the opportunities lost. Every moment you delay after experiencing profound fatigue is a gamble with your future, a risk that grows with each ignored episode until the inevitable catastrophe that could have been prevented with timely intervention. Please don't become another heartbreaking case study in my files, another family destroyed by a preventable stroke, another person who said, "If only I had known," when the warning sign was there all along. Take action today. If you've experienced unexplained fatigue, schedule medical evaluation tomorrow. If you've been dismissing symptoms, share this information tonight with anyone who might be at risk and unaware. The silent stroke symptom doesn't have to remain silent any longer. Not if we raise our voices to spread awareness, demand better medical attention, and refuse to accept profound fatigue as an inevitable part of aging. Your brain is sending signals when blood flow becomes compromised, desperate messages in the form of crushing fatigue that something is terribly wrong and needs immediate attention to prevent catastrophe. Listen to these signals, act on these warnings, and live the full, healthy life you deserve rather than becoming another statistic in the stroke epidemic that claims far too many who could have been saved. As a neurologist who has dedicated my career to treating stroke, I can offer advanced medical care after the damage occurs, but I'd much rather help you prevent that damage by recognizing and responding to warning signs. The choice is yours. Ignore profound fatigue and risk everything, or seek proper evaluation and potentially save your life, your independence, and your family from the devastation of preventable stroke. Thank you for reading this entire warning, and may this knowledge empower you to recognize the silent symptom that could save your life, transforming potential tragedy into prevention success through awareness and action.